Um, I know one of the things that parents are very concerned about treatments for asthma, especially in small children, are possible side effects. What should parents know about side effects, and is there anything that can be done for them?
The most common concern I hear from parents when it comes to asthma treatment, it goes towards steroids. And their main concern is if I put my child on steroids, something bad will happen to them. Primarily, there is some confusion about the concept of what type of steroids are in these drugs. There's some misconceptions that these steroids will make, their children grow large muscles or excessive hair, things of that nature, which can be seen with anabolic steroids. And that's certainly not the case with these. These types of steroids are called glucocorticoids or glucocorticosteroids, and these subclass of drugs are mainly anti-inflammatory. There have been a number of studies on the long-term use of low-dose inhaled steroids. Some of them have involved the nose, and those studies by far have shown minimal to no significant long-term side effects as far as steroids are concerned. And in fact, the FDA recently just approved the first over-the-counter version of a nasal steroid. The inhaled forms of steroids, which are deposited in the lungs, on the other hand, can be different. Those types of steroids are actually divided into different dosing strategies. Children on very low doses of inhaled steroids are found to be very safe. The long-term side effects are very much negligible. Kids who are on high doses of inhaled steroids actually can suffer some side effects long-term, including a reduced adult height, and indeed some other possible risk factors, including issues with bone density.
Is there anything that can be done about those side effects, or is that just something that parents need to recognize?
Well, unfortunately, the primary goal and how I approach treating my asthmatic patients is to first identify what subgroup of asthma they are in. Are they allergic or not? Because generally speaking, if they're an allergic asthmatic, you will be able to treat those allergies and avoid the use of high doses of inhaled steroids in the lungs. And it really does work incredibly well. On the other hand, if patients are not allergic or they actually are requiring the regular use of high-dose inhaled steroids, that's one of the indications to actually be referred to a specialist. Because as pulmonologists or as allergists, we are able to many times modify and identify subcategories of their causes of inflammation and perhaps use different medications that do not involve the use of steroids.